If you really find the right person, like therapist, chiropractor for you, and they really listen to your story and really help you understand what it is that's actually going on, I think that will actually change your life.
One of the most important skills is, just like you said, being able to listen to the client and to pick out those little nuances that may be the game changer in a sense.
I was completely blown away at like what PTs can do. Watching someone, how they move tells us more than they can tell us. I think I became more compassionate and trying to really build the relationships and foster that relationship with whoever it was for myself. We're always so focused on the there, but we forget about the little steps along the way.
I was in physical therapy school when I got to meet one of my mentors, and I was staying after hours because I was working on different screening tools and techniques that he had taught me. He's like leaving work and he's like, why are you still here? One, I'm working on my craft, but number two, there's traffic. I need to.
My job is to teach you to understand your body better, because the 23 hours outside of here is going to matter more than coming here for the hour. If people are believing in me, I need to believe in myself. So thank you.
Welcome to the HealthFit Huddle, where we keep you mobile and active, away from painkillers and surgery, so you can get back to the things that you love. I'm Dr. Jason Han, CEO and co-founder of HealthFit Physical Therapy and Chiropractic, and today our special guest is one of our own, Dr. Cheri Chan. She is a Bay Area native. She has some impressive accomplishments I want to tell you, and that includes being a collegiate javelin thrower at our alma mater, Cal Berkeley. She then went on to complete her Doctor of Physical Therapy degree at USC, where she was class president. I will add that. And in addition, that's after she graduated, she joined us here at HealthFit, and she's done some amazing things here. And now she's our elite physical therapist. So, welcome to the huddle.
Thank you for having me.
So let's get to it. Let's introduce you to everyone, and so they learn more about you. Can you tell us a little bit more about your background, your family, and where you grew up?
Yeah, so I grew up in San Francisco. Both of my parents immigrated from Hong Kong. And so growing up in San Francisco, it's very different than how I've learned to live in LA. I think the culture and the food is very similar. However, I do think being raised from, just immigrant parents, it's all about education, really trying to work hard and be disciplined. And I think that carried me through my high school career, my collegiate career, and not even graduate school. And I think growing up, I was speaking Cantonese for a while, and then I tried to fit in with my friends. And so I started speaking more English. And at home, when my parents would speak to me in Cantonese, I would actually reply in English. And now looking back, I wish I kind of kept that skill, because my parents say I have ABC, so like American born Chinese, just like my Cantonese is pretty rusty. And I think when I have Cantonese speaking patients, I find that I struggle, and that's something that I want to work on. So I grew up in SF, went to high school, played 3 sports. So I did tennis, basketball, and track. And it was really my dad who helped me kind of get into sports. My mom was always school first. My dad cared about academics, but he was like, I think you should try like athletics, because he really believed in something that I didn't see in myself. And that carried me through my high school career, even through college. And so when I went to Berkeley, I decided let me just try out. I'll walk onto the team, see how it goes. Didn't actually think I was going to stay. And I actually made the team because javelin is not very common. It's, for those who don't know, javelin is like a long spear. It's like made of aluminum. It's about 600 grams. So it's not very heavy, like over a pound. It's just a very awkward thing to throw. Like, it's not like throwing a baseball or a football. And so I did that for 4 years, made the top 10 on Cal's all-time top 10 list. The funniest part was my senior year, I was like 3 meters away from breaking the school record. Wow. And that's all I could focus on. Okay, I'm just going to 3 meters, which is really 6 feet or so. I failed. I couldn't do it because I was so set on just hitting that goal. My coach and I reflected, like, I forgot the steps along the way. I think that carried me through now as a PT. My patients have all these big goals, but it's like, how do I get them to focus on the steps to get there? Because we're always so focused on the there, but we forget about the little steps along the way. And so I think that was a really big lesson for me. And then after I took some time off, I worked as a personal trainer. We also call ourselves coaches because trainer and coach, I think, can go hand in hand. But I knew I was missing something. Like, it wasn't enough for me. I think I really wanted the hands-on. And so I applied to PT school, got into PT school, came down to LA, went to USC. And I challenged myself. I do not like public speaking at all. Mm-hmm. And I was like, well, if I run for class president, I'm going to have to be do public speaking. And so I did it, pushed myself outside the comfort zone. I really got lucky in terms of COVID because my graduation speech was online. I didn't have to stand on stage in front of like hundreds and hundreds of people. We actually filmed it beforehand and then we just did it live. Mm. And so I think that would have been a bigger test for me. And then I'm here at HealthFit now, and it's been almost 4 years.
If you go back, I want to know how you were as a kid when you were before high school and all this. Like, we know you as Cheri now, but were you always Cheri as a kid?
I'd be interested to hear what my mom would say if you asked her or my dad. I would say I've always been athletic my entire life. My dad took me to the park. We did a lot of monkey bars. That's the only reason he suggested I do javelin. He saw this kid throw it at like a club track practice, and he's like, what's that? Like, let's have you try it because I think you're strong. So then that's how it started. Mm-hmm. It wasn't anything crazy like, oh, my ancestors like were hunting, you know. Nothing, nothing like that for food, you know. And so I think, so I'm the oldest. I have a younger sister. Mm-hmm. She's about 3.5 years younger than me. We fought a lot growing up. Everything was always bickering. I was always the wrong one. You're a younger child?
Younger.
Oh.
I'm always right.
Yeah, exactly. So I got in trouble for everything. I was blamed for everything. And so that really caused a rift between my sister and I, but even between my parents and I. And it wasn't until we got older. She was actually diagnosed with lupus at 11. I was 15. That, I think, really shifted our dynamics. And we're actually very, very close now. I would say she's like my best friend. But going back to like the childhood, I was very rebellious.
Really?
Yes, because I was always told no. And if you tell a kid no, I mean, you have 2 kids, like, they're going to do it. And so I was like, okay, fine, that I'm doing all these things. Like, unfortunately, I have to admit, I was a little bit of a liar as a kid because I would do like little naughty things and then be like, oh, that wasn't me. Like, that was, you know, my sister Iris. And it was just like, I never really got away. Like, they always knew. Mm-hmm. But I think I laugh now because I'm like, I don't believe you. Like, I was never like that. Like, look at me now, right? Mm-hmm. But I think they have more proof and stories that, nah, I was a bad child.
So was it your sister's health situation that turned it? Or, like, what other things as you grew up changed that light for you? Yeah.
I would say, in general, I feel like I would have a darker history of growing up. I did experience a lot of death and grief growing up. My best friend passed away when we were 9 from leukemia. And I think that, and then my sister, and then some other things in high school related to death and grief really shifted how I was as a person. I think I became more compassionate in trying to really build the relationships and foster that relationship with whoever it was for myself. Like, I'm a people pleaser. I was doing everything for my parents, and I started to realize I think I need to do more for myself. And I think my relationship with my sister changed in a positive way, not just because of the diagnosis, but it was more of, I think we just got older, more mature, and kind of realized, like, without each other, we don't really have someone who really has our back, like, 24/7. And I think, you know, as an older sister, like, I am so, so appreciative of having a sister. I've always imagined what it would like to have a brother, but I don't know. We should ask your sister.
Well, you have Wayne, Jesus, and I as your brothers.
Yeah.
No, and that goes into my next question. Why did you decide to get into physical therapy? It's, yes, you're athletic. Yes, you became a coach, personal trainer. Mm-hmm. You say you wanted more hands-on, but I truly feel that whether it's physical therapy or whatever in the healthcare field, it goes beyond that. And I think it integrates a lot of the experiences that you've had in the past. So if you could kind of illustrate why did you want to go into physical therapy?
Well, it's funny because as an athlete, I was like, oh, I'm going to be that person on the field to help that athlete get back. Literally what you did.
Yeah.
I was like, oh, I'm going to be that person. And then I think I didn't actually go through PT really until college. I had like a stress fracture. I had some injuries, but like I never did PT. I don't know if that was just a matter of where PT was like 20 years ago to where we are now, of course. But I thought that's what I wanted to do. And then I had an opportunity to shadow one of my dad's friend's wife, who was a pediatric physical therapist at Stanford Children's Hospital. So I did my volunteering with her, and I was completely blown away at like what PTs can do. Like, oh, it's not just the athlete. There's so much more. I mean, even 3-month-olds who like need assistance, whether it's due to a health condition or like some other thing. And then working with the parents, and then seeing even adolescents that could benefit from physical therapy, not just athletic related. And that really opened up my mind. And so I did actually do more research to see like, oh, what other aspects are there under physical therapy? And so I think I started to explore more of those options. And then in college, I tore my ACL, throwing the javelin. And even then, I worked with an athletic trainer. I think in the sports world, it's very common for the athletic trainer to be with you first and the physical therapist. It was about a year recovery, but I came back, finished my senior year, and that's when I knew, like, okay, now that I've been on the other side of this long, grueling journey, hopefully I can use that to relate to my patients in the future. And so I worked as the coach, the trainer, like, it's just not enough. So then I pursued it again. Throughout school, we had different rotations. I was like, oh, maybe pediatrics. I was like, it's not quite the right fit for me. Geriatrics, it's okay. But I think for me, yes, like I want to help people, but there's so many different ways to help people. I think it's more of how I learned to understand my body and how it affected me and changed me in a more positive way. That's what I want to do for my patients, right? Because we can work together for an hour and it's great. But when you go home, if you don't really understand your own body, then I failed. Because my job, I want to give you that tool so that you can carry that through the rest of your life.
Yeah, I feel personally, for me, when I had my injuries and you went through a rehab process, it is what it is. It's like whatever that experience it is, what it is, and you're grateful for the experience. But once you get exposed to something else that, I'm not saying it's better, but there's a different lens. Then your brain goes into a place where I can actually make this better if I integrate this and integrate this. And that's kind of one of the big things that drove me was I had my share of injuries growing up. And when I actually, and the epiphany didn't really happen until I was in physical therapy school. When I got to meet one of my mentors, and what was happening? I was staying after hours because I was working on different screening tools and techniques that he had taught me. And I'm doing these things, and he's like leaving work, and he's like, why are you still here? I'm working on my craft, but number two, there's traffic. I need to spend like 2 hours before I get home. But he essentially said to me, well, let me look at you. And then he watched the way that I moved, and he said to me, what happened to your ankle? I'm like, what do you mean? I go, how can you even tell? It's like, when you do this motion, I can tell this happens. And I said to him, I had microfracture surgery on that ankle. And then he goes, if you think about it, if you can't load that, then it's going to go into different areas. And I started to, in my head, how come no one told me this before?
Right.
And if I would have known that at the time, would it have changed my trajectory in my athletic career? And throwing is a matter of inches, feet, or however you meters or whatever you want to call it. In fighting, it's a matter of split second. So for me personally, that kind of drives me when I look at these things, because it's personal. I want to give the most that I can to the person in front of me, so they don't have to feel as many of the hardships that I did. And that's partially me being older than you. But I think that's what drives me a bit. Do you see something similar?
Yeah. Yeah. I mean, I think it's only really been almost 4 years of practicing, and I feel like I've learned so much from when I started here. And I try to do the same thing, like just really watch how the person moves. I think watching someone, how they move tells us more than they can tell us. Because I think I'm guilty of it myself, like, oh, whatever happened to me when I was 10, like, doesn't affect me now, right? If you're 30, 40, whatever. But it's like, potentially, but then like your movement patterns have really developed and changed over those years. And so I think just educating my patients on that, and like, so then they can understand where I'm coming from. Like if they're coming for hip pain and we don't really touch the hip, to get them to understand that, because I think a lot of us tend to focus on the area of pain. And so I think that's really shaped how I kind of look at movement, look at people in general. Yeah,
definitely. So let's get down to the most important question. Why did you decide to apply here at HealthFit?
It's a good question.
It's a great question.
It's a great question. Yeah. Excellent question. When I was applying to different clinics, I knew what I was looking for. I knew I didn't want to work in the insurance-based model. And I actually took a leap of faith by, okay, as a new grad, I don't know if a cash-based clinic is like the right start for me, right? Because I want to get my approach, get my toes wet. And I looked at the website, I did the research, because I think I'm the type of person that does all my thorough research before like selecting a place. I think a lot of our patients do that too, which is why we're successful. And I saw about the whole like work-life balance and the community and the culture and the one-on-one care. And that is what really sold me. The one-on-one, 1 hour. And I was like, yes. Because when I went through PT myself, when I was in the clinical rotations for school, it was like 15 minutes and I'm like seeing 3 people at once, or like 30 minutes, and it's like an aides left and right, and it's just like very scrambled and very rushed. And I never felt like I could give that quality of care. And if they don't feel it, then I know that I'm not doing it my job. But it's like when I'm in that type of setting, I don't really have a choice. It feels very like a mill, just like boom, 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 boom. And I know that I've done 410s. And it's really burnt me. And I'm like, it's impossible to really take care of 20 plus people. And so that was the biggest selling point for me. And then, I had my call, and then we had our Zoom. And I think the Zoom gave me confidence, like, wow, this owner is actually kind of cool. Like, I don't know if you remember, but you kind of swore. And I was like, okay.
I probably did swear,
yeah,
yes.
I was like, okay, it's cool. And I think just seeing, I don't know, something about like being an Asian CEO. First, I think just like my upbringing and kind of seeing how, I mean, as a minority, like we can succeed, right? And so I think I really valued you and Kelly, and seeing that and just what you've created together. And I was like, okay, I know they're not really hiring right now, but let me just see if I apply. And I went through that process, and here we are now.
Yeah. You applied before you even graduated. I
did, because I was starting to look.
Yeah.
Got to prepare.
Yeah, we actually didn't have any ads out, and then you reached out, and we're always looking to talk to talented people, and to just get to know them and see if they're a good fit. And obviously, you're here now. How would you describe what's 4 years now?
This is the 4th year.
This is the 4th year. How would you describe your journey with us the last 4 years?
Well, I think the first 1.5 years was tough because of COVID. It wasn't really what I expected my career to start like. I think just learning to be comfortable with myself took a long time, and being confident in like, okay, these people are coming to see me. But I was like concerned, like, oh, well, what if they think I'm like not good enough, right? Because that's always been like a inner thought of mine, just with life in general. And I think I was just very fixated on, okay, check every single box that I've learned in school. And then I realized, well, that's not working. Okay, now I have to find something else. And I think the biggest thing was that there are, you were there, and like Daphne and Kevin at the time, like just creating that mentorship around for me to help me understand my own practice. And I think over time I got more confident in myself, but also like being okay with asking for help. That was the biggest thing for me, is like being okay with that. And I think now I'm like much more confident in when a patient comes in, I'm not just fixated on that one spot. I'm like looking at the whole body, how they actually move, not just what I'm hearing. But I also find that I've been listening a lot more than I was when I first started, because I think a person's story and the subjective part tells you so much more than what the objective test can tell you. And I've found that that's actually been more successful for me, at least in the last year and a half. And so I'm trying to carry that through, but then also being reflective on like, what am I still missing that I feel like I really struggle with? And then not being afraid to ask Sheena for help, or like everyone else, like I know we have our meetings. And I think I've gotten just more comfortable doing that. I think that was 4 years ago, I wouldn't have done that. I'd be like, yeah, I'm just going to figure it out on my own,
And I think I always say that, I've said it to you, I've said it to everyone here, is it's not just about what our skills are. We're always going to work on our skills, but I think one of the most important skills is, just like you said, being able to listen to the client and to pick out those little nuances that may be the game changer in a sense. Because we can always, if you want to get down to basics, get you more flexible, get you more mobile, get you stronger. But there's a lot of components that aren't on paper that if you're truly interested in them and you're truly interested in their progress, you may be able to pick it out. It's just like a good friend in a sense. And you've done it incredibly well. Like we always do, we always push that team camaraderie. And part of that is selflessness. And yes, we all have our own egos to a certain extent, but it's really have that strong ego, and you want to be your best, but also temper it in a sense where we can, the best way that we can succeed is with each other. So, one, you've done that, and I think you facilitated it with everyone else now that you're the lead. You're only 4 years in now that you're a lead. What other perspective of you don't have to get into the business side too much, but like as far as helping lead this team to succeed, and now that we're like looking for even other people to join, like where do you see your role?
Yeah, and I think learning to communicate with each person, but everyone communicates differently. So really understanding how each person works, just like our patients, is going to help, I think, facilitate this continued culture and family sense at HealthFit. And I think as I start to continue to get to know each of my colleagues, not just at work, but like outside too, like I'm trying to do more one-on-ones with everyone, but like more of like a genuine hangout or friendship, and let that develop. I think understanding how they work, what they need, not just from me, but maybe the front desk or like from management, I think that will help us succeed as a whole and continue to succeed. And I always try to be okay with asking like, hey, what do you need from me? What can I do better? Because I think we're really bad at asking that, or we're like afraid, because like, what if it's negative? But that's okay, right? Because we should be able to take constructive criticism or like feedback, because that's only going to help foster more growth. And I think we've done a really good job in like creating that with each other. Like, okay, no one be afraid of being judged, because no one is judging. Like, I hope that no one feels judged, our patients don't feel judged, that we're actually here to help, we're here to listen. And I think the biggest thing is just learning how to communicate with each person differently.
Do you think now that you're in a leadership position, has that helped with your relationships with your clients?
I think so, but I feel like with my patients, I've done a lot more holistic approach of like being more open about talking about like what is their mental health like, what is their stress outside of work, but like not just throwing it out there, because not everyone responds well to that, but like really trying to peel the layers to get to know them. And I feel like I've done a good job with each of my colleagues doing that, but it's like finding the right way to do it without feeling like I'm prying, but like I'm coming from like a caring standpoint. So I think with my patients, I think just being like just more confident and comfortable with communicating differently with them, and like really trying to pry the layers for them. And I think a lot of them respond well. Like even on the initial evaluation, like I've been learning a lot about my patients I didn't expect to learn from the first day. Like, you just met me, but here you are like sharing everything about you. And I'm like, if I can keep doing that, I think that's going to create just like a safety for them. And I think when people feel safe, they refer more people and just kind of share their experiences more.
Is there off the top of your head, is there like someone like a patient that stands out to you, whereas like you had a memorable communication or transformation with them? Is there someone that stands out in your head?
Yeah, I would say, I think one of my patients, he initially came in for post Achilles, but like 3 months out. Didn't do any PT beforehand. And very, very like motivated, ambitious person, athletic person. And to work with someone who's as strong-headed as I am, we can butt heads.
It's
like,
pretty
I'm
bad.
a Taurus.
Pretty bad.
Yeah. And so like taking that into reflection of like, okay, I'm going to take a step back and let this person be who they are, but then I can kind of change how I approach it, because butting heads is not going to get me anywhere. And I think just taking time to really educate and foster that relationship has carried us through. Did really well, went back to everything he was doing, and then he broke his hip. And that was like a freak accident, and very, very different for someone at that age, because usually we see older women who fall and break their hips. And so going through that whole process, it was trying to build that trust again. It's not that he really trusted me. It was more of the situation he was in. And I mean, I spent like countless sessions in the beginning where half of it was talking and listening and just making sure that he understood what our plan was and where I was thinking and if he was okay with it. And now we're back to like where he was before, doing everything, running, lifting, heavy. It's been amazing. And it's like, wow, I helped him. Like I did that. And it's like, normally, you know, you learn cases in school and like different diagnoses. Never seen this one in my life. But just because I haven't seen it doesn't mean that I can't be confident in like, okay, I know what I'm doing. I just have to remember all the training that I've learned. And like, I have you guys that I can do this because I'm trained to learn how to figure it out. Like as PTs, we're literally like figuring out the human puzzle. And I think that's the most fun part about the job.
Yeah, I know exactly this case that you're talking about. We spoke about it, but that's the thing. You had multiple lenses to look through with your team, whether it was the physical aspects or even like the emotional aspects. And like you said, you know your methodology. It's just there's different ways to get there. Mm-hmm. If you could you've kind of alluded to it already, but like if you can describe your methodology when it comes to physical therapy and rehab, how would you describe that?
Yeah, I find that it depends on why they're coming in. If it's more chronic pain, I find myself asking more about the personal life rather than just like, well, how did you hurt yourself? And like, what happened, right? I find myself digging more into the personal like aspect because I think it tells me more about them and like what they've been through, what they've tried, where their frustrations, because I think we carry a lot of that in our bodies. And I think a lot of us like think we know that, like, oh yeah, of course, stress carries here and like my back. But I don't think we actually realize like the true somatic physiological response that stress really gives us. I think they said like stress was like, what, number 6, like the vital sign or something like that. Maybe that was gait. But whatever.
You're smarter than me.
Yeah,
so
no. But I think we overlook that. And I think we actually have to really pay attention to that because especially with, I mean, after the pandemic, like everyone's stress levels changed, right? Good and bad. And I think if it's a more acute injury, I find myself focusing more on like reassuring them that they will be okay, but here is the process. I think in the beginning I was more of like, I'm just going to check every single box, subjective, objective, and then we'll just treat. But now it's more of like, maybe I don't need to do as much hands-on versus exercise or vice versa. I think with the higher level patients I have, I'm like, you know what? We don't need to do hands-on. Like we're here to train and get you stronger and like whatever it is you're getting back to. And so I think depending on who's coming, I try to look at each different box for myself because I don't think there's one size fits all.
Right.
And that's the biggest thing that I've learned too.
Yeah, it's an art.
Yeah.
At the end of the day, it's an art. Yes, it's a science, but it's absolutely an art. And a technique may be a technique, but you use it 5 different ways, 10 different ways, depending on the type of person, what they're trying to get back to, and all these psychosocial kind of things that you're alluding to. as well. Can you walk me through if someone comes in for an evaluation, what does that even look like when someone comes and meets you for the first time? What are the kind of things that you walk through for them?
Yeah, I kind of make sure that I read thoroughly the intake, but that any like notes that whoever scheduled them put in, so that, because I think sometimes they put notes in that gives you a cue of how this person might present, because you never know on paper, right, what that looks like, and pain is different for everyone. And so I kind of greet them, but then I ask them about their week, their day, depending on the time of the year. Like if it's summer, like, oh, have you gone on medications? And then I kind of tell them, like, just tell me what's going on. Like very open-ended, because I think that versus a closed, I forget what they're called, closed, open-ended, close-ended.
I understand
Basically,
what you're saying,
no yes
but
and
I
no.
don't know the definition.
Basically, no yes and no questions.
Yeah.
The more open-ended, the better, because I want them to tell me. And when they tell me, sometimes they continue and tell me things that I didn't expect. Maybe they didn't even expect it. And as I go through the story, I'm kind of picking up cues when I can. And then whether I'm starting the objective, I continue asking questions and listening to them, watch how they move, and just like explaining along the way of, oh, like, let's say we're assessing hip range of motion. I'm like, oh, like, is this okay? Like, what are you noticing? And I'm taking notes in my own head. And if they say like, oh yeah, I see like this side is tighter than the other, it's like, okay, we're just gonna make a note. Like we're just taking data points right now. It's usually what I tell them. And as we get through towards like the treatment part, I remind them like, okay, this is what we saw. Remember you felt this. Now we're going to see if we can change that. And then I do the treatment, and then I reassess. I'm like, okay, what do you feel? And most of the time, they're like, oh, I do feel different. Or like, oh, but then does it click for them on like why? Probably not. And so I kind of bring it back of like, okay, remember we talked about this. And based on what we saw, we changed this. And so this is why you're moving differently. Now, it's great to do it here together, but my job is to teach you to understand your body better, because the 23 hours outside of here is going to matter more than coming here for the hour. And then going through that process, re-explaining everything so that they can understand it. And I always tell them, like, I know it's a lot in this first session. Like, I'm probably word vomiting. What is your takeaway? Because I think if you ask someone, like, okay, so tell me what I just told you, you're really getting a sense of if they really heard and understood you. Because a lot of times we're like this when there's a lot of overload. Mm-hmm. Like I'm probably rambling now. And so I think
my wife asks me that all the time. So
that's it. I mean, then
yes.
She knows if you're listening.
Yes.
Yeah.
I'm always listening to my wife.
I'm sure you are.
Yeah. 100%.
Yeah.
Love you.
I mean, I think listening is hard. It's a skill. And I think active listening is what will carry us through. But then, and then I always check in with them the next day to make sure they got their exercises, they feel okay if they have questions, and then we kind of just build from there. But I've learned that I'm a blunt person, like a very direct person. I think I've gotten more blunt over the last few years. I don't know why. Maybe
I'm very blunt, so.
But I think
I'm okay with it.
Most of my patients appreciate that directness.
Yeah.
Like, I'm not here to beat around the bush. I don't have time for games. I'm not trying to waste your time and money, just like you're probably not trying to waste your time and money.
Yeah.
And so I tell them, like, this is what it's going to be like. Is that okay? Do you have questions? And I know I'm being direct with you, but this is how I work. Mm. And then, but I always read the person. Like, if I have to soften the directness, that's fine. I can. I think it's more of, like, getting them to understand, like, we're here for business. Like, yeah, we'll have fun, but, like, in the end, we're here to help you. Mm. And I think a lot of them appreciate that's why they stay.
Yeah, I think that's kind of my mode, or it really is my mode. I tell you how it is, but at the end of the day, I care.
Yeah.
And we can soften, we can sugarcoat for a certain amount of time, but if it gets to a point where you have to be a little bit more direct or a little bit more blunt, mm-hmm. that's just kind of what you have to do. Because at the end of the day, we don't want them to waste their time and money and efforts if it's not going to be in a positive direction. So we definitely have to work together
right.
In this relationship. So outside of HealthFit, what kinds of things do you like to do for fun on your own? You're pretty active.
I am. I mean, I wake up at like 5:15 every Monday through Friday to work out. I drag my husband to work out with me. I mean, he's a morning-ish person. You might disagree. But he has always been a runner, so I've been trying to be better about that. So, like, I'll go with him once a week. It's a struggle. I don't know how you run.
I don't run.
I don't know how Kelly runs.
Kelly runs. I don't run. Yeah.
But Saturdays we'll play tennis together. He picked it up during COVID, but I played in high school. And I think he's been having a lot of fun just, like, playing a new sport. Mm-hmm. And then I'll go bouldering on Sundays.
Nice.
Yeah. And we do like to cook together, try new restaurants. We'll do, like, the Alamo Draft House, like, where we'll watch a movie. But it's, like, the seats that recline, food and drinks are served. It's, like, very bougie. Now I'm like, oh, I can't go to an AMC.
So you're bougie. And what's one of your favorite foods?
Oh, you should ask.
This was not planned.
I came prepared.
Bread.
Yes.
She loves.
Only sourdough, though.
Why sourdough? Tell us.
You know, I don't actually know where it started from. I think being from San Francisco, if you haven't tried boudin, you must. It is the best sourdough. They also have clam chowder bowls. I'm no way sponsored by boudin, but you know, boudin, if you're listening, I would love to be sponsored to get your sourdough.
Sponsor us, please.
Yeah, please.
Yeah.
My sister and I don't know what it is, but we can eat bread all day, every day, straight up. Like, I probably have a loaf every week. Carbs are your friends, you know? I mean, yeah.
She loves bread. That's all she talks about. Probably like 80% of the time. You alluded to, yes, you work out. Mm-hmm. And you're newly married.
I am.
I'll let you finish your bread. And we talk about it a bit about we always have to be constantly trying to better ourselves if we're going to be better for our patients. What kinds of things do you do on your own time besides working out to at least center yourself and just be the best person that you can be?
Well, I was doing like therapy to understand myself so that I can be better for my husband, for my patients, for my friends, my family. I find that journaling has helped me a lot as well. Sometimes playing video games. I never really was a gamer. I mean, I had a GameCube. For those listening, I hope you know what a GameCube is. If you don't, what? It was like, you were like alive.
I was at like Nintendo.
Yeah, GameCube
Sega.
was like after. I don't know what that is.
See, exactly.
Do you know what N64?
I know.
Okay.
That's N64 was after I stopped playing.
Oh, you're old.
I am old.
He's old.
So, Super Nintendo. Okay. Started with a Nintendo, and then I believe someone had a Sega.
Wow.
And then we progressed to Super Nintendo, so Street Fighter.
Okay.
And then after that, I didn't play anymore.
I'm really bad at Street Fighter. I'm not great at Super Smash. And even Mario Kart. I'm like, I thought I was good, and then I play Brian's friends, and I'm like, wow, I'm really bad. His friends are really good. But back to the question. Yeah, I mean, to be honest, I think brain training helped me a lot. Just like really find myself and dial down that volume knob for like the anxiety and the stress. I think that's been the biggest change. Shout out to Vital.
Yeah. Neurofeedback, brain training. Vital,
really good.
Vital Brain Health in Pasadena.
Yeah.
Yes.
Yeah, I think just being more in tune with myself, how I'm feeling, just like a check-in. I think we should be able to check in with ourselves and like, okay, why am I feeling this? And then like, even if you don't think it's like something that's small, it could be that thing because it builds up over time. But I think I've learned to be more aware of that because I want to be the best partner I can be for my husband. And I can, you know, I mean, you and Kelly know each other inside and out now. If something's a little off, you know, even without her saying anything. So it's like, I think that's a skill. And I think as we get to know our patients, it's the same thing. As you get to know your patient, you should know, like, okay, today's like something is off today. Like, what's going on? Mm-hmm. Versus like if they come in bubbly and like life is great, right?
Right.
Yeah.
Alluding to that, what would you say is something that you didn't bring up? Name something that you didn't bring up, like one of your biggest challenges in life or at work. What would you say?
That I didn't bring up already?
Yeah.
Oh, that's tough. Because I think the biggest thing is something I already mentioned, like learning to ask for help. And I don't know if that's just like I'm not comfortable with it because I feel like, well, I can be independent. I can do it. Maybe it's how I was raised.
You're a bit type A.
Just a little. I really try to be type B. I don't think that's a thing. I don't think you can really try to change.
Yeah, it's definitely, we're cut of the same cloth, so it's definitely a skill to step back at times. And yes, it's good to be able to figure things out yourself, but if you have the resources around you, that's why they're there for. That's why they're there. So it's a balance between being smart and stubborn.
Yeah.
Needy. I don't even know what the balance is, but yeah.
I think another thing, though, that I haven't mentioned is, like, I can be impatient. Now, I don't mean that in a bad way. I think becoming a PT has really taught me patience, actually, especially when I'm working with, like, adolescents. I'm like, oh, my gosh, like, they're not listening. But even adults, like, they don't listen all the time.
Right.
I think it's more of, like, I really want to get someone better quickly, which is, like, why I like to do what I do. But that's not how it works. And I think learning to be okay with that, because if I feel that way, then my patients can feel that I'm trying to, like, rush.
Mm-hmm.
And if you talk to Brian, he's always like, you always go, right? Which is why I think brain training helped to slow that down. I just, like, I can't sit here and do nothing. That's, like, not great. Like, I don't know how to relax.
Who you're talking to.
I don't know how to relax. Relaxing is like going to work out.
Exactly. No, but that's your mode. Number one, that's your mode, and then you have to respect that too. So I think that we've talked about it, whether it's patients or even like personally in your life or my life, it's just to give ourselves some grace at times. And because we are who we are like the harshest critics. And yeah, it's tough. But that's why if you can talk to someone or someone that you trust or a team that you can trust, they can give you perspective. You may not like what you hear, but if they absolutely care for you, then it kind of makes sense from there. Kind of reversing back into the whole physical therapy space, what would you say to someone that's like living with a condition, minor aches and pains, or let's say moderate aches and pains, and they're saying, "Oh, it's okay. This is normal. It is what it is." You know, that's what a lot of people say. What would you say to someone like that?
I mean, I would want to know, like, what in their life is it actually affecting? Like, is it putting on a shirt? Is it doing chores? Playing with their grandkids? Like, what is it that's actually affecting versus just, well, I'm going to live with it? Because living with it can be a whole spectrum, like a range. But it's like, is there something that is really important to you that you have difficulty with? If so, we need to focus on that. And how do we get you out of that so that you can enjoy what you're doing? Not just learning to live with it. Because I think, like, I know people who say that they've probably tried all these different modalities and different treatments and different doctors. But I think if you really find the right person, like therapist, chiropractor for you, and they really listen to your story and really help you understand what it is that's actually going on, I think that will actually change your life. And I think that's why HealthFit stands out, is because we do care so much. Like, almost, I mean, not that caring too much is a bad thing, but like, you can see it in your team, like your employees. Like, I think you know that from all of us. Like, I don't think I've met a team of people who like care more, really. Like, and that's hard to find, because I think the industry of PT has been evolving and it's going to continue to change. And, you know, there's all these Instagram influencers and all these like YouTube stuff, but it's like, in the end, like, when we're on camera, it's kind of not really who you really are. I think you don't really get to know them. They're just telling you what they're supposed to tell you, or like what you want to hear. It's behind the scenes that really matters. So I think even if you're dealing with moderate pain, a lot of pain, mild pain, like, just give someone a shot who's really willing to listen to you.
All right. Well said.
Yeah.
Okay, last question. What are your future goals, both personally and professionally?
Personally, I think, you know, we've talked about having kids, maybe one for now, and just starting a family, whether it's in a different part of LA or like, we don't really know that part yet, but I think just creating a family, starting on our own, that's definitely a goal of ours. Professionally, I think just to continue to really learn about myself. I mean, I think there's so much to learn in physical therapy that like it's never going to end. And I think that's why I love this profession, because we're never going to be stagnant. Like, yes, we can be, but I choose not to be, because PT provides the opportunity where I can continue to learn. I mean, if I think 5 years from now, hopefully I have a family by then. And then I think I'm continuing to help HealthFit grow and expand. Like, maybe we'll have another location. I mean, that's part of my goal. I don't know if it's...
If we can make it happen, we can make it happen.
And I think just like continuing to have that holistic approach, like working with different team members and different disciplines. Like, I know we're starting that more, like, you know, with acupuncture and brain training, like all that stuff, I think is really going to be what the future will be like.
Yeah, for me, it's always important to have good people like you on board, and this entire team is great, and we've definitely evolved. And you alluded to it earlier where, yes, there's a skill portion, but at the end of the day, if we actually care. Yes, we're a business. Every business needs to be able to make money, to pay employees, to do all these things. But at the root of it all, if we mean well and we're doing it for the right reasons, the idea is that we continue to grow and we continue to achieve certain things. So, yeah, I can speak for Kelly and I that we really appreciate you, and I know the entire team appreciates you and everything that you've done, not only for the team, but all the success stories that you've had with your clients. So thank you so much for taking an hour out of your time today.
Well, thank you for trusting me as a new grad, really, to sign me on. You took that leap of faith. And I think the biggest thing that stood out was I see potential in you. And that's what my coach told me in college. I'm like, if people are believing in me, I need to believe in myself. So thank you.
Yeah. You look at the entire team, and where did a lot of people start out? And I'll always point out Jesus, right? Jesus, operations manager and marketing director. He applied a few years back as admin, didn't get it. You failed, Jesus. But anyways.
Because he had long hair.
So he didn't get the position. And then when a marketing position came up, he joined, or we brought him on part-time. And then I think within 2-3 weeks, I had him full-time because I saw the potential. I could see it. And now he's operations manager, marketing director, and everything in between. So I think this place is hopefully a place where people stay and kind of like you, like continue to thrive and make bigger impacts. So thank you for being on the huddle, and let's see who we have next.
Yeah. Eat bread.
Yes, bring it. We'll see you next time.
Hey, if you found this video useful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for our latest tips coming to you every week. Share this video with your family and friends. It might just make their day a little bit better. I'll see you soon.